Yes. If you'd like to stand, please feel free. Dr. Gilbert, come forward, please. Do you solemnly swear or affirm that the testimony you're about to give will be true and correct?
I do.
Please be seated. And you can pull that seat forward and adjust the microphone as you need.
Thank you.
Ms. Stone, you may inquire, Ms. Zoe, you may inquire when you're ready.
Thank you, Your Honor. Good afternoon. How are you?
Good.
Please state your name and spell your last name for the record.
Joyce Gilbert, Gilbert.
What is your profession?
I'm a pediatrician.
And are you licensed to practice your profession in Washington State?
Yes, I am.
And when were you licensed?
In 2014 for the state of Washington.
Okay. And were you licensed anywhere else prior to that?
Yes.
And which other states?
The state of Iowa, where I attended my residency program, and the state of Idaho, where I practiced medicine.
Okay. And how long did you practice medicine in Idaho?
For 30 years.
Okay. And what was your profession in Idaho?
I was a pediatrician in a small community in Idaho.
Okay. And Dr. Gilbert, if you could please describe to the jury your education background.
Yes, I attended undergraduate school at the University of Iowa. I attended my medical school also at the University of Iowa, and then I completed a 3-year pediatric residency training program at the University of Iowa.
Okay. And are you also a board certified pediatrician?
Yes, I am.
And what does board certification mean?
It's a rigorous system where the American Academy of Pediatrics makes sure that your training has been appropriate and that you followed all the educational requirements. And then on a yearly basis, you have to have a certain amount of continuing education within your profession, and you have to pass board examinations to continue to be board certified.
Okay. And Dr. Gilbert, what is a pediatrician?
A pediatrician is a person who specializes in the care of children from the moment of birth, generally until their 18th birthday, although in some situations we go even up until their 21st birthday. As a general pediatrician, we take care of every aspect of care. We go to deliveries, we'll resuscitate a baby who isn't breathing well, we'll take care of the babies in the hospital, we take care of babies and children who come in for routine well-child checkups and any minor illnesses or injuries. We'll hospitalize children for minor infections or anything that needs a general hospitalization. As a pediatrician, we can also take care of children in a higher acuity setting. So, for instance, if a child is very sick and needs to go to Mary Bridge Hospital or Seattle Children's Hospital, those are also pediatricians taking care of those children.
Okay. And Dr. Gilbert, you talk a little bit fast, so if you could slow down just a little so the court reporter can capture everything you're saying.
Yes, ma'am.
Thank you. And do you have a subspecialty as when it comes to pediatrics?
Yes, I do.
And what is that subspecialty?
I am also a child abuse pediatrician. So I specialize in taking care of children who have been injured or maltreated in any way.
Okay. And with regards to your subspecialty being in child abuse pediatrician, how long have you practiced that subspecialty?
Really, essentially, since I was a primary care pediatrician in Sandpoint, in the first week that I was there as a brand new pediatrician, the family doctors sent me the children who had been injured in any way or who they were concerned about any injuries for me to give them an opinion. At that time in 1985, there was no subspecialty on child abuse pediatrics. So as a general pediatrician, I was sent those children to confer and to give recommendations for treatment. Over the years, the subspecialty of child abuse pediatrics grew into a board certification process within the department or the American Academy of Pediatrics. By the time that happened in 2009, I was well entrenched as a primary care pediatrician and did not choose to go back for additional 3 years of training to then be able to become board certified in child abuse pediatrics. So currently, there are about 400 pediatricians like me around the country who are well trained in child abuse pediatrics, but not board certified. And there are another 350 board certified child abuse pediatricians who actually went through that additional training and have sat for those boards.
Okay. And Dr. Gilbert, you indicated that you're not board certified in child abuse pediatrics. During the course of your career, have you attended seminars or trainings when it comes to child abuse pediatrics?
Yes, extensively.
And have you also presented at those trainings? And where are you currently employed?
I'm employed by Providence St. Peter Hospital.
Okay. And what is your position at Providence St. Peter's Hospital?
I have 2 positions there. I am the medical director of the Providence Abuse Intervention Center, and I am also employed by Seattle Children's Hospital to be a pediatric-based hospital doctor at Providence St. Peter Hospital.
Okay. And what are some of your responsibilities as a hospitalist with Seattle Children's Hospital?
We attend deliveries for babies, and especially babies that there is concern that they may need to have assistance with breathing and respiratory effort at birth. Our hospital does 2,500 deliveries a year, so we will go anywhere from 5 to 10 deliveries in a 24-hour shift to support those babies. We take care of all the babies who are born at Providence St. Peter Hospital, both in the postpartum area where they stay with their parents, and also in a level 2 nursery where the sick babies come. It's a 13-bed nursery, and we will take care of any babies who are born 32 weeks, which is 2 months early and up. We will transfer babies who have serious medical conditions or are younger than 32 weeks. We will hospitalize pediatric patients up until their 18th birthday for any sort of infectious process or injury that they have. We will transfer children who require a higher level of care than our hospital can do. And we will do consultations in the emergency room for patients that have more complex health issues, and the emergency doctor would like our assistance in taking care of those children.
Okay. And are you also associated or have any affiliations with the University of Washington Department of Pediatrics?
Yes, I do.
And what is that association or affiliation?
I am considered an associate professor at the University of Washington. The medical students who are in their 3rd year and doing rotations will rotate in Providence St. Peter Hospital, and we are in charge of teaching them pediatrics while they're with us.
Okay. And you indicated that you are also the medical director for Providence Abuse Intervention Center. What is the Providence Abuse Intervention Center?
The Providence Abuse Intervention Center is a freestanding clinic in Lacey. Our clinic takes care of children in 5 counties of Thurston, Mason, Lewis, Grays Harbor, and Pacific counties. The referrals to our clinic come from medical professionals who are concerned about something that may have been occurring in that child's life. Also law enforcement and DCYF, the Department of Children, Youth, and Families, or CPS, will refer children to our clinic. We get referrals about physical abuse, sexual abuse, or any maltreatment to a child at all. And we will see those children in clinic or in the emergency room, or we will hospitalize those children at St. Peter Hospital if they need a higher level of care we will send them to either Mary Bridge Hospital or Seattle Children's Hospital.
Okay. And what are some of your responsibilities as the medical director?
As the medical director, I oversee all of the aspects of the Abuse Intervention Center. We have nurse practitioners who work and see patients. I have another lead nurse practitioner within the clinic who oversees the forensic nurse examiner program that provides services to children and adults in the emergency room who have been the victims of sexual assault. I oversee a nurse and front office staff and back office staff. So we have a complete staff of 8 to 9 people in our clinic, depending on the day. We are in charge of, again, running the program in the 5 counties. So we also are part of what's called a multidisciplinary team in each county, and we have meetings with law enforcement, CPS, prosecutors, mental health professionals, anybody who's involved in the ongoing care of a child after the abuse has occurred is going to be part of a multidisciplinary team to be sure that we're giving the best care to these children going forward.
Okay. And as the medical director of the Abuse Intervention Center, do you also see patients that are minors yourself?
Oh, yes, I do.
Okay. And how often do you see patients?
I see patients every day that I work. I will be the primary caretaker or the primary medical provider for patients about once a week or once every 2 weeks, depending on the schedule. I am the person who does all the consultations at the hospital, and I am the person who does what's called medical consultations through the Seattle Children's Program, where we will give the CPS workers information and answer questions about the cases that they are investigating.
Okay. And as part of your role as the a medical director at the Abuse Intervention Center, and then also with your subspecialty in child abuse pediatrics, have you ever examined patients yourself who may have suffered strangulation?
Yes, I have.
Okay. And are those patients under the age of 18?
Yes, they are.
Okay. And Dr. Gilbert, do you have any training in recognizing the physical signs of strangulation?
Yes.
And what is that training?
Through the conferences that we attend on a yearly basis, there's always an option to do a seminar or a training session on strangulation. I would say for roughly the past 10 to 15 years, each time I go to a conference, I'm either presenting or attending seminars. And so I am going to estimate that I've probably been to about 10 different presentations or seminars at these conferences. I also support and co-present with Heather, our nurse practitioner who runs the Forensic Nurse Examiner program, and we do outreach education to law enforcement and CPS about strangulation, how to recognize it, and what type of medical care is necessary.
Okay. And do you also have training in recognizing the effects of strangulation on the human body?
Yes.
And do you also have training in recognizing injuries to the human body as a result of strangulation?
Yes.
And in the medical context, what is strangulation?
Strangulation is external pressure or force on the neck that involves the arteries, the veins, and the airway. That external force is different than choking, where something gets caught inside the throat and causes obstruction of airway. This is an external process.
Okay. And Dr. Gilbert, you testify that in the medical context, strangulation means external force applied to the neck. You also testified when you're giving the description of strangulation that it's different than the medical definition of choking. My question to you is, based on your experience in seeing patients who indicate they may have been strangled, have you ever had patients, when describing being strangled, use the term that they were being choked?
Yes, frequently.
Okay. And what are some ways that strangulation in the medical context can occur?
There's a number of ways that this can occur. It can be with a ligature, such as hanging or string or something around the neck. It can be a force by another person, causing pressure on the airway and the blood vessels with a arm or a hand or both hands. It can be a knee applied to the neck structures and obstructing airway and blood. There are many ways that a strangulation episode can occur.
Okay. And based on your training experience, Dr. Gilbert, is the neck vulnerable to external injuries?
Yes.
And why is it vulnerable to external injuries?
Again, the neck is our area that allows blood flow to and from the head and air to enter from the mouth down to the lungs and the chest. So being a vulnerable area means that if there is obstruction to either blood flow or air, then that is a life-threatening injury or issue for that patient.
Okay. Your Honor, I think this may actually be a good stopping point.
All right. Members of the jury, at this time, the bailiffs will come forward and lead you back. We're at the end of the day. Thank you very much for your time and attention. I remind you of all the instructions that I have given you and request that you continue to be vigilant to ensure that you are not exposed to any outside information related to this case. We will see you tomorrow morning.